Okay, hi everybody. Good evening. I think we can get started. I'd like to welcome you to this evening's webinar put on by Homewood Health about mental health during COVID-19 for healthcare professionals. My name is Katherine Sisak, and I've been with Homewood Health since 2016. First as a trauma therapy specialist, where I was working with people doing individual and group psychotherapy. Um, and currently I'm working as a clinical manager where I oversee our national trauma care program and our national depression care program. So for this evening's presentation, I'd just really like to thank you all for taking the time to participate and to attend tonight's webinar. It's really my privilege to have this time with you this evening, and my hope is that some of the information that's offered will be supportive and helpful to you during this time. So I would encourage you just to really take this time to sit back and to listen and just reflect on how some of these concepts, might relate to your own life or to your loved ones, to your colleagues. And following this evening's webinar, after December 7th, you will be emailed a link to the webinar where you will have an audio recording of tonight's presentation as well. We are a fairly large group this evening. I can see we're at about 60 people so far. And so if you do have any questions, I would encourage you please to use the chat feature. And I'll do my best to answer questions throughout the webinar. I'll stop every so often, and I'll make sure we've got some time at the end as well for questions. Okay, so moving right along. What we'll be talking about this evening is what are the psychological impacts of COVID-19 on healthcare professionals who are really at the front line of this pandemic day in and day out, looking at some concepts including trauma, moral injury, compassion fatigue, and burnout, and then specifically looking at what might be some signs and symptoms of psychological distress. Again, this might apply to yourself, your colleagues, your loved ones, spouses, and so forth. And then we'll end this evening by looking at what are some strategies, so some really practical things to be able to cope during this time, and as well some resources. So our objectives are to increase awareness and really self-awareness, how you might be impacted as a healthcare professional working the front lines during the pandemic, and then what are some strategies and resources that are available to you during this time. So what we know already, and there's already studies and research being done on the impact of working the front lines of this particular pandemic on healthcare professionals. And so we know that healthcare workers can experience really considerable psychological distress as a result of the COVID-19 pandemic. And this is due to a number of things, including providing direct patient care, could be vicarious trauma, quarantine, or self-isolation. So what we really see now is people impacted by a number of stressors, both in their work and personal lives. So it could be related to increased or decreased workload or new responsibilities. So being asked to work on a unit, on a floor, with a population, shifts that typically is not something that you do, or it's not your preference. You might be worried about your own family, your own loved ones contracting COVID-19, about yourself contracting COVID-19, about social isolation. You might be affected, most people are affected by all the things that you might have been doing to replenish yourself and recharge yourself on days off, the gym, social contact, your faith community, all those really important things. Now there's limits on all of those, right? So huge impact. Childcare issues. So fortunately, most schools are open at this point. But as soon as there's a case in your child's classroom and your child's daycare, it's shut down for 2 weeks. So what do you do as a healthcare professional who is expected to be at work and now you've got no childcare, right? Financial hardship. So it might not be yourself, but it might be your spouse, your adult children, parents. A lot of people across most industries are experiencing and impacted by unemployment, right? So this certainly impacts as well. So a lot of significant areas of impact. And so looking at some statistics, and some of what's being done now is looking back at SARS and what we've learned from that. And so we already know that from the SARS outbreak and early reports related to COVID-19, that healthcare professionals are experiencing considerable anxiety, stress, and fear. And so a study that was done in China, where they surveyed 1,257 nurses and physicians, what they found was that of that group of healthcare providers who were providing direct care to COVID-19 patients, they experienced significantly more depression, anxiety, insomnia, and distress than providers who didn't work directly with patients who had COVID-19 or in a COVID clinic. And we know that healthcare providers can be particularly vulnerable to negative mental health impacts of COVID-19. And this is partly due to their greater risk of exposure to the virus, right? Having concerns about infecting loved ones, intensifying work conditions, and shortages of PPE, shortages of resources, shortages of space, right? All these material resources, and there being shortages and restrictions and so forth. As well, those who provide direct care to patients with COVID-19 and then unfortunately a friend or a family member goes on to become infected, or those who have been quarantined, they might be 2 to 3 times more likely to develop symptoms of post-traumatic stress than those who were not exposed to these conditions. Okay, and so studies looking at the mental health of healthcare workers after SARS indicated that the symptoms of post-traumatic stress and other mental illnesses can persist for up to 3 years after the end of the pandemic. So we already know that from SARS, and so it's really critical that during this time, we're in the middle of the pandemic, we know that healthcare professionals are impacted, their mental health is impacted, and it can continue to be for up to 3 years after or more. So it's really essential that we're kind of at the forefront of this and providing support where it's so important to provide. So we're going to be looking at trauma, moral injury, and then compassion fatigue and burnout, right? And so, I mean, all of us experience stress on a daily basis, a regular basis, whether it's at work or at home, and might be daily stressors like deadlines or meetings, traffic, juggling family needs. These are all those kind of typical stressors that are common for most of us. And then we might also face more intense experiences, right? Like illness, caring for an aging parent, stress at work, financial stress, major losses, could even be positive stressors like moving, a new vehicle, promotion at work, adding a baby to the family. But even those positive stressors still put a stress and a strain and impact us, right? And so in most of those cases, though, we do have the capacity to cope with a range of those life experiences. And, in spite of coping with those stresses, overall, you are okay and you're able to function in your personal and professional life, right? Thinking about trauma, though, with trauma, that term is really used to describe an event, or it could be a series of events or a set of circumstances that's experienced as physically or emotionally harmful or life-threatening. And really what's key here is that it overwhelms our ability to cope, and it has lasting adverse effects on a person's mental, physical, social, emotional, or spiritual well-being. Okay, and so the traumatic events that healthcare professionals, of course, might face come in many forms, and they might range from one-time incidents like an accident or a particular case, or a single experience of violence. It could be things like that, and it could also be things that are more chronic or generational, like abuse, racism, bullying, community violence, and so forth. And so really, whether an event or a circumstance is traumatic, it really depends on the person's experience of that event, right? So you might have 5 healthcare professionals who worked the same call or the same case or the same patient, and each person will have a unique experience of that event. And so we really can't say that a particular situation, like witnessing violence, even for example, is always traumatic for everyone. And whether an event is experienced as traumatic, it's really influenced by many factors. And that might include our own internal coping strategies, what's going on in our own lives at that time, the supports that we have in that life, and other broader community supports and societal factors that really shape and influence how we respond to our experiences, right? So, I mean, the key point really here is that it's a unique experience, and whether an event is experienced as traumatic is really going to depend on how that event is experienced by the person themselves, right? So if we think about what causes trauma-related symptoms, a really key piece here is for us to think about the brain and the amygdala, right? And so the amygdala is really this kind of built-in alarm system. And essentially its job is to keep us alive, right? So when there is real or perceived danger, the amygdala is going to fire, and that's what is kind of experienced is that fight, flight, or freeze response to protect ourselves, to protect those around us, and keep ourselves safe. With trauma, though, and really working as a healthcare professional and working in traumatic situations potentially, it can also impact executive functioning, right? And this is where the thinking center of the brain kind of becomes overloaded, or some people refer to this as the amygdala hijack, right? Where instead of the amygdala being able to kind of pick up and notice and detect actual signs of danger, everything starts to feel urgent or desperate. And so that's, again, what we call the amygdala hijack. And so I'll just give you an example, right? If you think about the amygdala being this alarm system that we all have, and say, for example, if you think about your vehicle, and if your vehicle happens to have a car alarm, connected to it, and so a person is going to break into your vehicle and is going to rob your vehicle, for example, right? The car alarm goes off because the alarm, the sensor has detected that there's a threat, there's danger. The alarm goes off. Now, say, for example, you have parked your car in a parking lot, you've gotten a bunch of groceries and your arms are full of groceries, and you go to get into your vehicle and you bump into your vehicle because your arms are full, and the alarm goes off again. So in this case, the sensor has responded the same way, with the alarm going off, kind of responding to danger. But in fact, what has set off the alarm is quite different. In the first case, it was an actual danger, a person breaking into the vehicle. And in the second case, it was a perceived danger. It was the sensor could just detect that somebody was bumping into the car. And so much the same happens in terms of trauma, right? And so it could be, for example, that you did a difficult call at a particular intersection, or you did a particular, there was a particularly difficult intervention or interaction, or a particularly difficult story that you heard in a particular place, right? And so, and you experience that as quite difficult as a healthcare professional and as a person. Now, several months forward, you're at the same intersection and you hear hot sirens going, or you're in the same hospital room, you're in the same shelter room, or you see a person that reminds you of the person that you were supporting, the patient that you were intervening with some months back. Your amygdala can actually fire for action, and it interprets the intersection, the sirens, the hospital room, the patient, all those things in the environment, and it actually gets ready to act, right? And so that might look like you can feel your adrenaline pumping, you can kind of feel yourself getting amped up and ready to act. You might be scanning the area, you might be looking for signs of danger, and so forth, okay? And so when the danger passes, what should happen is the alarm system should settle as the parasympathetic nervous system gets activated, okay? But as we discussed, trauma impairs the functioning of that alarm system. So it starts to become difficult to distinguish between what is real danger. Is it a person breaking into my vehicle? Or is this a perceived danger? Is this just me bumping into my vehicle and setting off the alarm? So if you think about the settings where you work and the type of work that you do, and have there been times where you can feel some of those, you can feel yourself becoming activated, and was it real danger? Was it perceived danger? And part of what's really important in terms of understanding how we're impacted by this is considering triggers, right? And so a trigger is really an event, object, or cue that sets off feelings of anxiety, fear, anger, or other types of distress. And the key thing with the trigger is that when we're exposed to it, when it's experienced, it can actually feel like that traumatic event is actually happening in real time versus it being a memory, okay? So, examples of triggers could be things like sounds, smells, certain places. It could be a person behaving a certain way that reminds you of a certain person you've worked with, a certain client, a certain patient, someone who's behaving erratically, for example. And in the next slide, we'll look at, some of the symptoms that you might experience related to being exposed to those triggers. So just having a look at this model, so this is sort of one way to understand how you might be impacted by triggers and what's called the dangerous world feedback loop. So as we discussed, with triggers and with the amygdala being impacted, the brain starts to have difficulty at times to be able to distinguish between what is real or actual threat or danger versus it being perceived, right? And so in the number one there, where you see the person's face, right? What happens is that something in the environment brings out the body memory of fear. So this is where you're safe, right? Everyone around you is safe, but you're at the intersection, you're in the hospital room, you're around a person, you hear a sound, you smell a smell, and it kind of brings you back to that traumatic event, right? And so number two is that increased fear, increased level of hyperarousal. So your body starts to respond as though the traumatic or dangerous or threatening situation is actually happening in live time. And that's where you start to get ready to act and respond, to fight, to engage, to respond, to flight, to remove yourself, to withdraw, or freezing as well. And so what starts to happen is that over time, as experiencing more and more triggers, is you might start to perceive the environment as dangerous, right? And so for healthcare professionals who, again, are really at, by the nature of their work and then being at the front line of the pandemic, it's possible that you start to see the world, start to see people as being unsafe, as dangerous. You're constantly always scanning because of the nature of your work for safety, assessing risk, assessing danger. And number four is that it sort of starts to build and fuel this loop whereby by seeing the world as potentially more dangerous and unsafe, it actually makes, it increases vulnerability and susceptibility to be impacted by these triggers, right? So kind of the take home with this is reflecting on your own experience, your own history, your story, both personal and professional, and thinking about what are the triggers for you, right? What are the things that you might experience that bring you back or that kind of set off some of the signs and symptoms that we're going to be talking about next, right? So when you do experience something that feels traumatic for you, or that is a traumatic event, a critical incident, or even to a trigger, there's a number of signs and symptoms that you might experience, and there's many of them, right, ranging from physical, cognitive and mental, emotional and behavioral. So I'll just leave this up for a moment so you can take a look, but thinking about for yourself, which are the ones that you experience or that your colleagues experience, loved ones, and so on. And so if we think about trauma at work and how this shows up, it's going to be a unique experience for each person, of course, but really, some of the ways that trauma and being impacted by trauma at work, it might look like having difficulty remembering or concentrating on tasks. It might look like having difficulty managing time or completing tasks, meeting deadlines, that kind of thing. Feelings of fear and anxiety about completing your usual duties, unreasonable reactions to normal situations, anger outbursts and interpersonal conflicts, excessive fatigue and abnormal sleep patterns, having difficulty to cope with stressful events, avoidance of certain job duties that you might have previously were doing and felt competent and confident doing, increased alcohol use, and I would include, anything that you would use to numb and cope. So alcohol, substance use, gambling, shopping, any kind of risk-taking behaviors, that sort of thing. And then having issues with performance. So I think the key thing here is to consider any changes in your own work functioning, your own work performance. And again, this might apply to colleagues, to loved ones. And if you think about, considering where you are now and how you were functioning at work pre, let's say, March 2020, right, as kind of an anchor in time, right, what have been some of the impacts for you in terms of working the front lines of the pandemic, some of the really unprecedented situations that you may have been dealing with, and how this has impacted you in terms of your work life and your work functioning, right? So any changes in that area. And so if we look at moral injury, and so this concept was developed in military settings where soldiers were returning from deployment, having been involved in events that went against deeply held moral convictions. And so while both military service and healthcare vocations, people might choose them for altruistic reasons, to help others, to have an impact and so forth. The difference with healthcare, I think, is that there's this underlying assumption that it is the role of healthcare workers to heal and to cause no harm. And so when situations come up that do not allow healthcare workers to deliver care in the way that they've been trained, that is to help people and to do no harm, this can be associated with this experience of what we call a moral challenge or a moral injury, right? And really what it is this feeling of either I have done something wrong, I have done something that goes against my code, my morals, my values, my ethics, what I deeply believe in, or it might be that I have seen or heard, I have witnessed someone do something that violates my own morals. And so these situations, they exist on a continuum, from less to more severe. And so that's why the term moral challenge as well as moral injury is used, just to kind of, reflect that these things exist on a continuum, right? And so some of the, some examples of things that a healthcare professional could experience as a moral challenge or potential moral injury, it could be, being caught in this dilemma of being prepared to make that personal sacrifice, to really put yourself in harm's way, to work on the front lines, to help others, and then this natural desire to avoid infection, to protect yourself, to protect your family, being afraid of what might be the consequences for your family. Perhaps you have an immunocompromised spouse, child, parent, whatever the case may be, right? So this dilemma could be experienced as a moral challenge. Might be needing to quarantine when you're needed at work, and the stress that you might feel knowing that your colleagues are already really stretched to the max. Might be being asked to come in when you're ill because that's how much you're needed in your particular workplace, your unit, etc. It could be, the requirement or the decision to quarantine from family for weeks at a time, depending on your role, right? Making decisions about which patients will receive certain resources or equipment, discontinuing face-to-face appointments. So, depending on your role, offering virtual sessions only can be a moral challenge for some. And then there's, of course, witnessing moral injury, right? And so this is where really demand exceeds capacity. And it might be things like working in a system where certain medical procedures are being postponed. It might be that there's rules about families not being allowed to visit loved ones in the hospital. It might be, what we see, the hoarding of food and toiletry items, people not taking social distancing rules seriously, having to discharge patients earlier to avoid infection, reducing human contact, human touch to avoid infection. All these experiences can be experienced as a moral injury or as a moral challenge. And so, highlighting here really that the feelings linked to moral injury really vary. When it's something that you may have done that goes against your own beliefs, your own values, your own code, a person might experience feelings of guilt, shame, or embarrassment. When it's something that you've witnessed someone else or a system do something that goes against your code, typically it's more feelings of contempt, anger, or disgust that come up, okay? And so in terms of the cycle of moral injury, right, there's a transgression, so something happens. So for example, you enforce the rule that families cannot visit their loved one in the hospital, for example, right? And then you experience this dissonance or conflict. You believe in connection. You believe in, connection and support as part of a person's healing and recovery. So it really goes against, your beliefs and your principles. You make an internal attribution, right? So the way that we cope, and this is just part of our nature, the way that we cope and kind of reconcile that conflict of I did something that goes against my code, goes against my values, is we make what's called an internal attribution. So essentially you blame yourself, right? I should have done something better. There's something else I could have done differently. I could have advocated more. I could have found a way. I should have asked such and such person. I'm not a good nurse, paramedic, whatever, right? And so really attributing it to yourself, and as a result, feeling perhaps feelings of shame and guilt and anxiety, perhaps withdrawing and avoiding. And as this can kind of intensify, we know that with moral injury, people can actually experience symptoms that mimic or are much like post-traumatic stress disorder. So things like avoidance, intrusions, numbing, and self-harming, okay? And so part of what comes up as well with moral injury and moral challenges is really this self-criticism, which comes back to that idea of the internal attribution of I'm not a good healthcare professional. There's something else I could have done differently. I didn't try hard enough. And so I think it's to just, especially during this kind of extraordinary time of being at the front line of a pandemic, really taking stock and noticing about how you're speaking to yourself, what's that inner dialogue, how you're explaining these very difficult situations to yourself, and just noticing any self-criticism that might come up. And so with the moral challenge or moral injury that we discussed, where it's another system that has, or another person that has done something that goes against your code, there might be a sense of betrayal often. So just as an example, say for example, in your community, wherever you are in Canada, your public health comes out with certain guidelines about how many people can get together and whether or not you can be, in homes and so forth. And the local leaders come out and support that as well and enforce it about how important it is. And then you go on to hear, the community goes on to hear that, one or two of the local leaders ended up not following those rules and ended up having a gathering in their home of multiple households and so forth, right? So learning that everyone's not following the same rules, this would be an example of potentially a moral challenge and the sense of betrayal that can come with that, right? So just moving us on to compassion fatigue. So really, compassion fatigue is kind of an occupational hazard, I think, of working in a helping field. And it's really about carrying the weight of the situations that you're intervening in, carrying the weight of the stories that you might hear. And compassion fatigue, we're really not talking about being impacted by one particular loss or one particular situation. we're talking about prolonged exposure to, it could be low grade or it could be kind of higher grade, more significant, but traumatic events, difficult situations, people's suffering and pain and adversity that they're experiencing, that exposure to that. And so certainly this comes up for healthcare professionals. And, I think it's important to note that for many people who go into a helping role, very often these are individuals who may be helpers in their personal lives, right? And so have been, helping and supporting even before going into this field, or they're also doing it in their personal life in parallel with their work life, right? So that exposure can be very high and quite intense. So really, we're talking about the impact of accumulated effects of caring over time. And so when we talk about chronic compassion fatigue, it's really that consequence of prolonged low-grade exposure to loss, right? And so if we look at, why it's important to deal with compassion fatigue, really it can have a really significant impact, right? It's this idea that negativity can really fester. It's kind of that open wound that just will not heal, but in fact is getting worse. It impacts work life, and then of course spill over into your home life as well, right? So for unresolved compassion fatigue, one of the things that sometimes people experience is kind of this muting of emotions, so sort of this numbness, this flatness. People telling you, my spouse told me it's like I don't have any feelings. I'm not happy. I'm not sad. I'm not mad. I'm just kind of numb, right? And so this can be sort of one of those signs that there might be some compassion fatigue going on, right? And so in terms of the impacts of compassion fatigue and just the different ways that it can impact, it might be emotional, right? It could be your relationships, how you enjoy your job, and then your emotional responses. So things like sorrow or anger, resentment, irritability, right? These are all the kind of emotional responses related to compassion fatigue. You might also experience this really significant sense of responsibility. I can't leave, people are counting on me. Or you might feel numb or contrarily really hypersensitive to other people's issues, or this reduced feeling of empathy, right? Might be physical, so issues with sleep and insomnia. In terms of social, you might feel like, no one understands, or no one except other healthcare professionals who are seeing what I'm seeing and doing what I'm doing day in and day out can understand. And so you find yourself withdrawing from certain people, certain family members who just don't get it, right? And in terms of professional, right, so there might be, again, boundary issues in terms of how you're working. Again, there might be different interpersonal conflicts, just losing that sense of humor, losing the sense of sort of a team spirit, and so forth. And then spiritual, right? And so a number of people have talked about the impact that COVID-19 has had in terms of almost like from an existential perspective, what's the point? Do I matter? Do all my efforts matter? This feeling of kind of, shoveling smoke. And so really these effects of compassion fatigue can extend into multiple areas of life, right? And again, it exists on a continuum, so it might be from low stress, medium, high, all the way up to severe stress. So again, just taking stock about where you might be in this. So when we talk about burnout, I mean, compassion fatigue and burnout are certainly related, but they are distinct. And unfortunately, there's no reason that they can't exist at the same time. Burnout really refers to more sort of the tasks of the job as opposed to being exposed to people suffering and accompanying people through their suffering. So burnout might be related to feeling a real lack of control, which certainly applies very much so now with the reality of COVID. Might be a dysfunctional workplace environment. And that does include dealing with a volatile and sometimes threatening public, right? It could be a lack of support and isolation, and then just having a struggle with a work-life imbalance. So some of the consequences of burnout, and I'll let you have a look at this list here, right? But really the idea is that by ignoring or not addressing burnout, it can really have some pretty significant consequences on mental and physical health and wellness. So again, at the beginning of the presentation, I mentioned that one of the goals here really is to increase self-awareness. So before getting to that point of burnout, being able to notice, what's taking stock, what's going on with me, how am I doing, what do I need, so that you can notice before the gas tank is empty, that something's going on with you, and that you might be impacted and need some support, right? And really, I think it's that shift of instead of, what is wrong with me to, what has happened to me, right? What has happened to me? What are the situations, the cases that I've been intervening in, that the calls that I've been doing, and then what's been the impact on me, right? So number of other burnout symptoms, right, from apathy to feelings of hopelessness, disillusionment, alienation, depression, right? There's quite a number of them. Okay. So turning now to what are some strategies. We know that this is really an unprecedented time with COVID-19, the sense of chaos and loss and grief that people are experiencing, and just the lack of predictability, how our mobility in terms of being able to go where we want to go, when we want to go, how we want to get there. I mean, these are some really, really significant impacts. So how to cope with that, right? So some of the strategies that we'll look at are tolerating uncertainty and distress, self-regulation of emotion, and radical acceptance. I'll review mindfulness and relaxation skills, self-compassion, and then just underscoring really the importance of maintaining our social connections, social relationships during this time. So, one of the ideas and really one of the strategies is to focus on what you can control. Now, this is a very difficult shift, and I think a really difficult concept for healthcare professionals, where being in control and managing situations and managing variables is really critical to the life-saving work that is being done. So it really goes against the grain and against the way that people are trained and the way people operate to be able to do this type of work. That being said, when possible, the idea is really to focus on what we can control during this time of uncertainty. So, I can't control if other people are following social distancing rules or how much toilet paper is at the store. I, don't really know what things are going to look like in a year, hopefully better, right? But what I can control is, maybe taking news breaks, taking breaks from social media, taking care of my own physical health, my own social distancing, and that kind of thing, okay? And so in terms of emotion management strategies, so the first strategy there is tolerating negative emotions. And what this really goes back to is that we know from the research that there is a link between avoiding our emotions and anxiety and depression. And so the idea here is really to build a tolerance of emotions. And so what that looks like is that, say I, just come home from a shift and I'm feeling really sad, really depressed, really demoralized. And instead of trying to make that really awful feeling go away by numbing myself somehow, shopping, substances, etc., the idea with this strategy is to really actually tolerate the feeling, right? Notice the feeling that I'm experiencing and sit with it, try to let it pass. Might be self-soothing in a way that does not make the problem or feeling worse, okay? And so with extreme emotions, things like anger, for example, some of the strategies related to this is that we're really trying to reduce the intensity of that feeling, right? So just as an example, say, for example, you've worked a double shift, you come home and, you're exhausted, you've done a number of difficult interventions, there have been difficult situations, and you're just done. and you come home to see people in your community gathering in fairly large numbers. They're not wearing masks. They're standing fairly close together. And you've just come home from this double shift, and you feel like lashing out, right? And you experience kind of these extreme emotions. And so one of the skills here is what's called opposite action. So this skill is really about when you feel that intense emotion, whatever it is, noticing what your impulse is. So what do you feel like doing? So you might feel like getting out of your car and yelling at them, approaching them somehow. So acting opposite to that impulse, it might look like heading home and turning inwards and taking care of yourself, right? And I was speaking with a nurse the other day, and she said after her shift, it was a difficult one, and she said, I'm going to go home, and tonight and tomorrow, my day off, I'm going to nurse myself, right? So it's this idea of acting opposite to the impulse and really redirecting those feelings. So in terms of healthy thinking, I mean, we know, and the link is well established between how we think, what our inner voice is, with how we feel and what we do, right? And so the thing with our thoughts is really to consider our thoughts as data, as information, but not as facts, right? So we're always kind of evaluating what our thoughts are, noticing them, observing them, and noticing how they make us feel, right? And so we need to really be kind of aware of any kinds of thinking traps, or, some people call these cognitive distortions, and we all have them, and we all use them in different ways. And there might be some here that you use more often than others, right? But this is really kind of a universal experience, so to speak, these negative ways of thinking, or more distorted ways of thinking. Right, so there's a number of common thinking traps there. So just as a couple of examples, so all or nothing. So this might be going back to my neighbor example there. It might be that the neighbors shouldn't be getting together at all, period. There's no way to get together safely. There's no way to have social connection safely now, right? It doesn't take into account the outdoors, wearing masks, distancing, and so forth. Jumping to conclusions might be like, the neighbors are behaving in a completely entitled way, and as those social distancing guidelines do not apply to them. Catastrophizing might look like things are never going to get better, and these neighbors getting together sends a message to the other neighbors that it's okay to get together. Things are only going to get worse, right? So again, just paying attention to your thoughts. A good way of doing this, I find, or kind of a practical way, is to go backwards. So once you've had maybe a really intense emotional reaction to something, something's really bothered you, triggered you, set you off, to kind of rewind and think about not just the events, but also your interpretation of the events, how you explain those events to yourself, that have that are part of the situation as well, right? So taking into account your thoughts. Radical acceptance. So this concept, if you Google it, there's been quite a lot written about it, but it's really the idea of acceptance, and radical refers to the root. So it means accepting a situation in its entirety from its root. This does not mean agreeing or condoning a particular situation, but it does mean accepting the impact of a situation on you, for example, and essentially not struggling against the quicksand, right? So continuing with healthy thinking, visualization is very helpful. So if you find yourself going down a rabbit hole, or you're kind of, obsessing over something or ruminating over something, kind of literally picturing a stop sign, like stop, right? Just to be able to observe what your thoughts are, to describe them. Being a scientist or detective, so I mentioned this, really treating your thoughts as data, but not as facts necessarily, right? We need to kind of consider further. Generating alternative explanations. So what are some other ways of seeing this situation? What evidence do I have for this thought? Is there any other evidence that would make me see this differently, perhaps? And then what are some helpful coping thoughts, right? What would you say to a friend? Putting it in context. How much is this going to matter in so many months or so many years? Okay. Practicing mindfulness and gratitude. So mindfulness is really about paying attention in a particular way. And that includes when we're in moments of suffering or pain or angst, right? Staying present to that feeling, like I mentioned before, and not avoiding or withdrawing from it. And then gratitude, right? So in the midst of some very difficult situations, what is going well? What is something that you experience a sense of gratitude for, and spending some time to reflect on that. And so some daily practices might be something like mindful breathing, right? Really allowing yourself to inhale and exhale, and bringing your concentration and your focus to your body, feeling your chest rising and falling, noticing that tension being released as you're breathing. Might be practicing things like progressive muscle relaxation to release tension. Thinking about really like what went well today, what was one thing that went pretty good, that went okay. And then also expressing appreciation to others. Might be a text message. We know that it makes the other person feel good, but it also makes the sender, the person who has expressed gratitude, feel good as well. So these are all small but really significant strategies in terms of coping, and supporting self. And then in terms of self-compassion, right? So we talked about compassion fatigue. And so it's not just being fatigued in terms of being able to hold space for others suffering and pain and offering them compassion, but it's also kind of a loss of compassion for self, right? So, working at the front line of this pandemic, you will be tired, and that's okay, right? And so having compassion for what the reality is at this time, okay? And so if this is a concept you're interested in, Kristen Neff, and her name is at the bottom of that slide there, Neff, she's one of the world's leading experts on self-compassion. And if you Google her name, she's got a fantastic website and some really great exercises. I do them myself, about different ways to practice self-compassion. And so she really highlights that, there's always one person that you can count on to provide compassion. And that one person who's always with you is yourself, right? And so she identifies that there's three components of self-compassion. So self-kindness versus judgment. So it's really about actively comforting and soothing yourself, putting yourself first, saying things to yourself like, this would be really hard for other people in this situation as well. Common humanity versus isolation. So again, framing your experience, framing your response in light of the common human experience. Most of my colleagues would find this really difficult. And just reminding yourself that, having a hard time, making mistakes, not being able to do 100%. I mean, this is just part of the human experience, right? And then mindfulness versus over-identification. So instead of really taking it on, it's about having compassion for yourself and, giving yourself loving kindness, so that in a way you have this protective buffer from the negative effects of the suffering that you're supporting people through and accompanying people with. Maintaining social connections, so whatever that might look like, right? If you can do things like socially distanced walks and get-togethers, distanced and that kind of thing. All the phone calls, the Zoom calls. People are doing like virtual, Christmas and holiday gatherings now. So all of those things that, it's different. It's not the way that it usually is. So there's certainly a loss and grief there for some. But doing what we can to maintain social connections is really, really important in terms of, a strategy for our mental health. And then other strategies are things like regulation of routines. So we know that during the time of unpredictability, one of the best things that we can do for ourselves, to do for those who depend on us, is to have some kind of regular, it can be very simple, but some kind of regular routine. Physical activity that literally might be taking a 5 or 10 minute walk, but just getting the body moving, paying attention to our sleep needs, paying attention to nutrition, right? And then some self-care tips. So this is really going to be unique to what your needs are, what your preferences are. It might be if you're more extroverted, having more of those Zoom calls and Zoom connections and social connection. It might be, doing things that are more inward, but taking the time to care for self. It might be taking the time to organize your environment or a room in your environment. Just to care for self. And again, this is sort of one of those things that you have some control over, right? And then supporting yourself, right? And so, as healthcare professionals, you think about the patients, the clients that you work with, and you're taking their vitals, right? And you're checking in on them. How are they? You're constantly monitoring and adjusting. And really, it's about doing the same for yourself. Taking your own vitals throughout the day. How am I physically, mentally, emotionally, socially, spiritually? Am I okay? What area is lacking? What's something small that I can do for myself today to support myself in this work that I'm doing? Okay. And then, of course, there's the Employee and Family Assistance Program, right? And so if this is something that your employer makes available to you, your Employee and Family Assistance Program can help you with a range of situations really that are listed there. Impact by COVID-19, but then of course, any kind of mental health concerns or substance concerns, family and parenting concerns, legal concerns. So really taking advantage of that as needed, right? So the EFAP program through Homewood Health, it is accessible toll-free 24 hours a day, 7 days a week, 365 days a year. You can access it through telephone, video, or online through homeweb.ca. And I will just notice or note that it is private and it is confidential, right? So there's definitely still a stigma, but reaching out for help. I think that stigma is even more prevalent if you are in a helping role yourself, but allowing yourself to reach out for support as needed and being reassured, as I said, that it is confidential. How to access it. So the phone number is there. So 1-800-663-1142, as well online, homewoodhealth.com. Okay. And Wellness Together. So this is an initiative, and really it's something that's available to all Canadians, which is wonderful. So this was announced by Prime Minister Justin Trudeau. And there's a number of partners in this initiative, and Homewood Health is a proud lead partner. And really it's about providing Canadians, all Canadians, access to mental health support during this time. Kids Help Phone is another partner. And so to access these services or to get more information, you can go to wellnesstogether.ca, or you can call 1-866-585-0445. Okay, so that brings us to the end of the presentation. So I know there's been a lot of information, and as I said, after December 7th, the link for the webinar will be sent to you, so you'll be able to refer to it as needed. I'll just take a moment to see if any questions pop up. I haven't, there's none right now. Okay. So if there's no questions that come up, I would just like to again thank each of you for coming this evening and for taking the time to participate and attend. It's been my privilege to have this time with you. And I'd like to thank you for not just attending the webinar, but also all of the important and the invaluable work that you're doing at this time.